So I'm going to go ahead and share an interesting story. Um, this was an incident that I went through at my residency site, or actually my fellowship site for pain management. And to this day, it still is etched in my memory, partly because it is one of the few times that I have encountered sort of psychopathic, sociopathic individual. And I know I'm using the terms incorrectly, but basically it's a super charming individual who says something absolutely ludicrous, which for 30 seconds seems to make the most sense in the world, and you begin to question if they just might be right. And then thankfully, I kind of came to my senses relatively quickly and was able to put a stop to what could have been a really bad situation. But I've had the opportunity of meeting these very charismatic, sociopathic people several times in my life, and I'm glad I have, because it has taught me some very valuable lessons on working with these people and trying to make sure that nothing bad happens to me as well. So I had a gentleman who came in as a patient to the clinic that I was in, and he stated that he had pain, which made sense. That's the pain clinic he was at. And I inquired as to where his pain was, and he stated that it was in his legs. It was in both of his legs, and that it was the result of a motorcycle accident, and he had developed what was known as road rash on his legs. Now, let me explain road rash. So basically, in essence, a person, it can happen to anyone, but generally we talk about it a lot for people that ride motorcycles. They ride, they're not wearing a lot of protective gear, or even if they are, sometimes they're thrown from the motorcycle due to a collision or some other incident, and they go ahead and slide on the ground, scraping off some or a lot of their skin, depending on the situation. And it can be very life-threatening because muscle can be involved, and the person can lose a lot of blood and a lot of cells. So he said that basically he had pain because of this road rash in his legs. Now, what was already striking about that story is road rash is not something you go into a clinic with. Road rash is actually something that, if it occurs to you, you end up going to the emergency room. They end up treating it acutely, and then you get some long-term treatment with a wound care specialist, and generally your road rash will resolve, albeit probably with some scarring depending on the amount of damage. But basically, he said that he had ongoing road rash that just never healed, and he was having pain in his legs because of that. So I went ahead and told him to show me his legs, and sure enough, he exposed both of his shins to me. And sure enough, he had what appeared to be classic road rash going down both of his shins on the right and the left. And this apparently had been going on for about a year. So I'm beginning to wonder, why has this road rash not healed? Obviously, it's painful. It's this open sore, but it should have healed by now. And so I went ahead and I said, have you seen an infectious disease doctor? What's going on? Why these wounds don't heal? And then he said the following. He said, well, the reason they don't heal is because I am a heroin user. I am a heroin user by choice. I do not intend on detoxing. I have control of my habits, and I plan to continue using heroin. And I used to inject the heroin, and I don't inject it anymore because someone told me, hey, you have road rash on your legs, which means you have a bunch of exposed blood vessels. Why don't you just coat your road rash with the heroin? That way you don't have to inject it, and it gets absorbed into your bloodstream as if it was an injection. And so basically, the reason why his wounds in his legs had not healed is because he kept applying basically non-sterile slash dirty heroin onto the wounds. And so they just stayed open for the amount of time. And I said to him, okay, well, what can I do for you? And he said, well, I would like pain medication, specifically of the narcotic type, in order to deal with the pain from the open sores. I said, okay. I said, but if you stop using heroin, your sores would close and then you wouldn't have pain anymore, right? And he says, well, it's my right to use heroin. It's my choice. I'm making a conscious decision, and I wish to continue using heroin. And your job as a pain doctor is to treat my pain, and I'm here and I have pain, and you're required to treat it. For about 30 seconds, I kind of thought he had a point. Well, he makes a decision. It might not be a decision I agree with, but it's an adult making a decision, and he has pain. I'm like, wait a second. And the thing about it is he was super charming, super well-spoken, not very well dressed, probably homeless, but still had all the just amazing way of presenting himself and presenting his case. And so I said, okay, well, the real treatment is for you to let the wounds to heal. That's the real treatment, because we don't want to treat pain. We want to treat the root of the pain, the cause of the pain. And that's what real pain management is about. It's not about providing a Band-Aid. It's about treating the underlying cause of the disease. And at this point, now he starts getting irate. And he says, you have to provide me with pain medication. That's just the way it is. You have to provide me with pain medication. So I began to think of other pain medications that might be helpful, which of course he stated would not be helpful because only opioids helped. And the conversation unfortunately continued to devolve. And he said, you have to give me some type of adequate advice. And I said, well, I don't know what to tell you, but I guess, if you're saying that heroin helps you in so many ways and it also helps with pain, then I guess maybe you should probably use more heroin to cover up for the pain that you have in your wounds. Now, granted, that probably wasn't the best thing to say, and I don't think any of my training at that time could have prepared me on how to handle that situation any better than I did at that time. But it was definitely a very interesting interaction for me. His presentation, the way he stated that he needed help, the way he seemed so cognizant of everything that was going on, for 30 seconds had me stumbling and almost thinking, well, maybe I should give him opioids for his pain. But then I was able to get back in touch with reality, with my training, with science, and I was able to deflect this intense, charismatic, logical-minded individual. But it could have turned out worse. I could have ended up giving him a prescription that could have made me be the cause of the end of his life. And certainly that's not my goal. Obviously now I probably would have offered him counseling and things like that, although honestly he seemed pretty confident in what he was asking for and confident in his decision that he wanted to continue to use his substances recreationally. So I doubt anything would have really made an impact. I would have handled it differently, but it was definitely a very bizarre encounter, one that I hope not too many people have to go through. In any case, thank you all. Take care and goodbye.